Q1. Dressing for blister. A. Hydrocolloid or foam dressing. B. No dressing. C. Silver dressing. Q2. When do you see P waves before QRS? A. Fibrillation. B. Afibrillation. C. Flat asystole. D. Continuous fluctuation. Q3. A working time directive sits under which policy? A. Equality and diversity. B. Freedom of info. C. Health and safety. D. Human resource. Q4. A patient with end-of-life care becomes unresponsive. The nurse asks the relative if the patient filled a DNR form. What does she mean? A. Do not initiate respiratory resuscitation. B. Do not run. C. Do not initiate cardiopulmonary resuscitation. D. Provide care and safety. Q5. Which medication leads black color stool? A. Furosemide. B. Paracetamol. C. Iron. Q6. When you don't understand the accent of your patient, what will you do? A. Write whatever you hear. B. Assume what patient has said. C. Seek clarification from patient. Q7. You are dressing the wound of a patient on a surgical ward and are required to do so using the aseptic non-touch technique, ANTT. Which of the following is the definition of asepsis? A. Free from all microorganisms. B. Absence of systematic inflammatory response syndrome, SIRS, criteria. C. Free from marks and stains. D. Free from pathogenic organisms in sufficient numbers to cause infection. Q8. How would you provide support for a 16-year-old patient to reduce anxiety during physical examination? A. Provide privacy and dignity. B. Remain with the patient and provide support. C. Do not intervene and intervene only when the doctor tells you. Q9. As a nurse, you are treating a patient who had asthma attack. How would you assess if the medication is effective? A. Patient can walk at a short distance. B. Peak flow. C. Normal heart rate. D. Normal blood pressure. Q10. In hypoglycemic patient after giving oral glucose syrup, when will you check next general random blood sugar, GRBS? A. Immediately. B. After 5 to 10 minutes. C. After 15 to 20 minutes. D. After 30 minutes. Q11. What is the meaning of CBT? A. Cognitive behavioral therapy. B. Competency-based test. C. Computer-based test. D. Cognitive behavioral test. Q12. Barrel chest is noted on patients with A. Emphysema. B. COPD. C. Asthma. D. Smokers. Q13. How do you know NG tube is in place? A. Check pH of aspirate. B. CT scan. C. X-ray. D. Introduce air. Q14. Who would you speak with in end-of-life care? A. Patient first. B. Patient and relative together. C. Relative. Q15. Spinal fracture patient, how will you ensure airway? A. Jaw thrust. B. Head tilt. C. Open mouth. D. Chin lift. Q16. A staff caring for an isolation patient, where you will keep the records. A. Inside the patient room. B. Outside the wall of room. C. Nurse station. Q17. What should the nurse check for a patient with catheter in situ? A. Infection. B. Bruising. C. Swelling. D. Redness. Q18. What will not be used for a deaf person? A. Lip reading. B. Actions. C. Sign language. D. Basal. Q19. Who can complete checklist for full care assessment? A. Trained professional. B. Consultant. C. Junior doctor. D. Relative. Q20. When does a nurse take a patient's daily weight? A. Before breakfast. B. At the same time every day. C. After lunch. D. Before bedtime. Q21. Group A controlled drugs. A. Morphine. B. Midazolam. C. Codeine. D. Canjapram. Q22. Blanchable skin can be assessed by nurse as A. Skin that turns red or dark when pressure is applied and returns back suddenly. B. Skin that turns red or dark and returns back slowly. C. Skin that turns white or pale when pressure is applied and returns back immediately. D. Skin that turns white or pale when pressure is applied and returns back slowly.
Please don't forget like and subscribe. Thank you.
Q23. A newly qualified nurse is not yet well versed when it comes to documentation. A nurse in charge noticed this is the case and went to report the new nurse to the nurse manager. What could the newly qualified nurse have done in order to prevent this incident? A. Ignore the report and just continue with what she was doing. B. She could have told the manager beforehand in order to have support and additional training. C. Apologize that she was not able to inform her immediate head beforehand. Ask for policies of the hospital in relation to documentation. Q24. Young, hospitalized children are at risk to develop A. Poor mental health. B. Neurological disorder. C. Cancer. D. Will die young. Q25. After an audit round, the manager tells a nurse about the outcome and possible development suggested by the team members. What action will the nurse take? A. Accept and keep the report in a file for reference purpose. B. Thank the manager and tell her that the suggested action will be looked into in due course. C. Plan how to meet with the manager to discuss the solution. Q26. What are the first action a RN should take on a patient who is having tonic-clonic seizure? A. Administer sedative medication dosage in 15 L and complete AE assessment. B. Call for help, ensure safe position and apply 15 L of oxygen. C. Attach to monitoring, call for help, inform family. D. Give patient something to bite on, call for help and attach monitoring. Q27. NHS gives the most portion of budget to A. Alcohol and drug abuse. B. Elderly chronic disease. C. Adolescent. D. Blood-borne diseases. Q28. Golden treatment for MI. A. Primary percutaneous coronary intervention, PPCI. B. Coronary artery bypass graft, CABG. C. Thrombolytic. D. Peripheral intravenous catheter, PIC. Q29. What policy relating to dress is mandatory in all clinical areas in the hospital? A. Everyone must wear designated uniforms. B. Everyone arm must bear below the elbow. C. Everyone must wear gloves when examining a patient. D. Everyone must wear bespoke hospital footwear. Q30. Lithium therapy is indicated for A. Bipolar disorder. B. Schizophrenia. C. Tonic-clonic seizure. D. Depression. Q31. A client is in the process of turning from male to female. When you want to educate client on catheterization as a nurse, what will you do? A. Teach male catheterization. B. Teach female catheterization. C. Both. Q32. Pain scale of 5 out of 10. What medication will you give? A. Diclo plus tramadol. B. Paracetamol. C. Morphine. D. Codeine. Q33. Who is not allowed to give medication? A. Dietitian. B. Healthcare assistant. C. Nurse practitioner. D. Nurse. Q34. Abbey pain scale is used for patients. A. Birth to 1 year. B. Pregnant women. C. Dementia patients. Q35. Best valid and accurate research method. A. Systematic review of descriptive and qualitative method. B. Quasi-experimental. C. Randomized. D. Non-randomized. Q36. For revalidation, how can a nurse give 5 pieces of feedback? A. Verbal only. B. Written or verbally only. C. Verbal, written or survey. Q37. Chemotherapy and hormone waste disposal container. A. Purple. B. Yellow. C. Orange. D. Black. Q38. Which is the first act on all legal issues? A. Safeguard Act. B. Healthcare Act. C. Equity Act. D. Equality Act. Q39. When a patient is having a surgery to switch from male to female, you need to teach self-catheterization. What would you do? A. Discuss with patient what surgery he has undergone and teach him. B. Reads the notes. C. Teach both male and female catheterization. D. Get a doctor to teach as you are not competent. Q40. Which one of these notifiable disease needs to be reported on a national level? A. Chickenpox. B. Tuberculosis. C. Whooping cough. D. Influenza. Q41. Management of moderate malnutrition in children. A. Supplementary nutrition. B. Immediate hospitalization. C. Weekly assessment. D. Document intake for 3 days. Q42. How does a senior nurse manage the situation when a staff member informs her that she is pregnant? A. Inform the health and safety lead. B. Undertake the risk management. C. Arrange for cover immediately. D. Inform other staff. Q43. Decerebrated posture in which patients? A. Hernia. B. MI. C. Stroke. D. Brain stem damage. Q44. According to reporting of injuries, Diseases and Dangerous Occurrences Regulations, RIDA, Legislative. What will you do when a staff has an accident at workplace causing fracture of the femur? A. Report the accident. B. Report the accident to a doctor on site. C. Record the incidents in a management book. Q45. A patient's elder sister who is a nurse and friend requested for the patient's result. What will be your action? A. Give it to her since she is your colleague. B. Do not give because the patient has not permitted you and explain your responsibilities. C. Give and end your friendship with her. D. Do not give but tell her about the result. Q46. One of the patients keep on complaining regarding the care. What will you do? A. Tell the patient to write complain and send via email. B. Instruct the patient to complain to in charge. C. Listen carefully and honest solution. Q47. There is a policy that urine should be measured every 2 hours. How would a nurse manager evaluate compliance? A. Ask them to verbalize they are doing it. B. Perform clinical audit. C. Check nursing notes at the beginning of every shift. Q48. What is the average hourly urine production for an adult? A. 0 to 10 ml hour. B. 40 to 80 ml hour. C. 20 to 30 ml hour. D. 100 to 200 ml hour. Q49. An obese patient with limited communication wants to lose weight. Who should the nurse involve? A. Occupational therapist, GP dietitian, and social worker. B. Physiotherapist, nurse, GP dietitian. C. Occupation therapist, psychiatrist. D. Physiotherapist and social worker. Q50. In dehydration patient, what will you infuse? A. Crystalloid glucose. B. Colloid glucose. C. Blood transfusion. D. Plasma. Q51. What is patient-centered care? A. Caring for patient with dignity and respect. B. Understanding patient's feeling and providing necessary needs accordingly. C. Helping patient to gain insight to her problem.